How do we improve our cybersecurity? What are the Medicare compliance programs? How do we improve our frustrations with the electronic medical record? What is coming down the line in the area of information technology? Learn the answers to these questions and many more on this episode of the Talk2MeDoc Podcast.
Welcome to the Talk2MeDoc Podcast, where it's all about communication among the entire healthcare team. Let's talk to each other more effectively so that we can truly help our patients. And now your host, Dr. Andrew Tisser.
Hey guys, it's Andrew. Welcome back to the Talk2MeDoc Podcast. I've missed you. For our returning listeners, thank you for your ongoing support. For our new listeners, thanks for joining. You're in for a treat because on this episode, like every episode, I'm bringing you the best guests from all around healthcare to talk about the healthcare worker experience and how we can fix it. This episode brings Joe Gellatly onto the show. Joe is the CEO and co-founder of Medcurity Incorporated. Medcurity is a cloud-based software platform that helps hospitals and clinics manage their privacy and security requirements. Previously, Joe had a consulting company that provided guidance on MACRA/MIPS, new payment models, and information technology. Joe has also served on the board of directors for CHAS Health, a federally qualified health center, for over 10 years. He lives in Spokane, Washington, with his wife Bonnie and 4 kids. Well, without further ado, let's get talking to Joe. Joe Gellatly, welcome to the Talk2MeDoc Podcast.
Andrew, thank you for having me. It's a privilege and exciting to be a part of this show.
Thanks. I really appreciate that. So, Joe, I recorded a little bio about you, but for the listeners, could you provide a little description of who you are, what you're doing, and your current role in healthcare?
Absolutely. So again, my name's Joe Gellatly. My background has been in healthcare on more the IT and the policy side. So both working toward, over the past couple of decades, especially around moving into healthcare's electronic medical record initiatives, as well as complying with the type of programs that are coming out from CMS along the lines of meaningful use, now MACRA MIPS. So these are payment programs that have been rolled out. So my background was working with hospitals and clinics and care providers in meeting the requirements and, hopefully actually getting value out of the technology, not just putting it in place to meet regulatory requirements. And in the past couple of years, I've narrowed my focus. Now I am a co-founder of a startup that is focused on the security and privacy requirements. So especially HIPAA requirements that we have to fall under and meet. And we're working to bring some clarity and more of a sense of where to start, what to do to meet those requirements that we have that help us protect patient information. So that's Medcurity, and that's been an exciting project, exciting startup to be a part of. We're taking, as much as HIPAA doesn't sound exciting, we're taking some pretty complex requirements, and we're, again, breaking those down in a way that the people that end up with the responsibility to work on those, they're usually wearing 12 or 15 other hats too. And so we wanted to take that, help them understand how to do a risk analysis, which is one of the requirements on an annual basis, how to understand what they need to be focused on and working toward to stay compliant. And so that's a big part of what I'm doing right now. I've also been on the board of a federally qualified health center for about 12 years now. And that's an important part to me of what I get to do, volunteer and be a part of that aspect of the healthcare ecosystem as well. And we get to do some interesting things with the community health center as well. And so those are a couple of things that are probably the most time-consuming parts of my healthcare career right now and where I'm spending most of my time.
Yeah, very interesting. So do you mostly work with organizations, or are you working with the administrators? Who is your target audience?
So from a Medcurity perspective, it depends on the size of the organization who ends up with that role or that requirement. So it's often practice administrators. In small practices, we're working directly with a physician. we're just trying to take that slice of what they're responsible for, and regardless of whom that is, and then we work with hospitals at the CIO level there, often, or chief compliance officer. But every one of those roles, they have a lot of other things to work on. So what we're doing is say, okay, so starting with that security risk analysis, there are a lot of threats. There are a lot of things that we need to be aware of and risks. And what happens if we ignore those as a healthcare organization can have some really significant implications for us. And so all those roles that we work with, they do a lot of other things too. So we're trying to help this piece of it, which is usually their fifth or sixth or seventh in a priority list. So they don't ever get to it in the day-to-day, but it may be keeping them awake at night. So we help them get a handle on this and begin to feel like they know what they should be doing to meet those requirements and avoid the penalties that are being handed out, and to protect the organization against ransomware. And there's data theft issues. So we're seeing a lot of different kinds of attacks on clinics and hospitals these days. And it's all these things that can keep any of these roles up at night. Those are what we want to bring in some clarity on how to help protect your organization against that.
So it's not just HIPAA, it's cybersecurity as well as a whole?
It absolutely, yeah. It runs right into that. So HIPAA, even though that was mostly drafted 20 years ago, the security rule actually came out in 2004. There wasn't a lot of specificity in that. So there's safeguards you're supposed to have in place for your clinic or your hospital to protect the patient information from an administrative standpoint. So training your staff, putting appropriate policies in place, and then physical. So what's your facility controls? How do you protect the clinic or the institution, the actual building itself? And then technical. And the technical safeguards have evolved, but the principles still hold true. But now the types of attacks that we're seeing are like ransomware attacks, where what happens is patient information, whether it's actually stolen or just locked or encrypted or somehow made unavailable to the practice, that still goes under the HIPAA breach categorization. So the Office of Civil Rights, the federal entity that enforces the HIPAA breach penalties, they consider a ransomware event to be a HIPAA breach. They come in and investigate following that. They say, show us your risk analysis that you were doing, show us the policies you had in place, show us the things you were doing to protect against this. So we've seen the cybersecurity issues roll right up into this. And so part of what we're doing, although we focused initially and primarily on HIPAA compliance, we've seen that part of the responsibility that we have being there is, okay, so how do we protect against the type of ways that attackers take into a network, which would include primarily actually phishing. So emails that trick your employees into giving away credentials or compromising accounts or allowing access to their workstation. That all fits right under the HIPAA requirements. And so what that means is, for these groups that have brought us in to help, it's a difficult situation because A, you're already dealing with an incident that has public relations implications. There's a lot of cost and cleanup when you have something like that happen. But then B, you've got the government saying, hey, were you even complying with these requirements that you had in the first place to protect that information? And so then you're having to kind of be in a defensive position and showing, from like an audit perspective, showing what you were doing to protect your clinic. That's exactly the kind of situation that we want to step into and be helpful in.
Yeah, that's pretty interesting. I mean, I feel like your day-to-day regular doctor is probably thinking, okay, well, I don't share any of my patient information and I got passwords and everything, so I don't have to think or care about this stuff. But from what you're telling me, that's not true at all.
Well, yeah, there's definitely a baseline that has some specific requirements. I think if you look at what you should have foundationally, you've named a couple of those things. I mean, there are some password requirements. There are some just almost common sense type protecting the information that you're holding. But there's more than that, even in the foundational compliance with the security rules. So where I mentioned that risk analysis, where you're actually doing a process to look at all the areas you could be taking advantage of. And policies are really critical too. And where these come into play are if there was an audit. And audits can come from, if you're doing, so that MIPS, the Merit-Based Incentive Payment System from CMS, if you're participating in this Medicare payment program, they do audit you and they do ask for that security risk assessment. And so you have, and then if a breach occurs, you have these multiple paths that could lead to you having to show that you were doing the right thing, whether it's because of, an incident happened or not. You want to have those documentation, those documents available, and you want to show that you were doing kind of that baseline to show that you as a practice were not negligent, that maybe this incident occurred, maybe an employee accidentally dumped the shred bin into the dumpster. This happened. And there's been multiple cases of this, and they've resulted sometimes in even, there's a single doc practice that ended up with a $110,000 penalty because their shred bin was accidentally dumped into a dumpster, but they didn't have policies saying, here's how we handle patient information on paper, and they didn't have training that they could show that they'd provided their patients. So those penalties come out, but they're more attached to, were you doing that baseline compliance work that you're supposed to be doing, and this happened anyway, or were you not doing that the training and the principles that are required as a covered entity under HIPAA?
Sure. Well, yeah. I mean, you don't even think about like silly things like that, but and then when it starts coming down to dollars and cents, I think people pay attention real quick. I mean,
yes. Yep. So, it's something we unwind and we look at those type of penalties as they come up and try to understand. Just really quickly, the Office of Civil Rights, when they come into a situation like that, they have the freedom to assess a penalty between $100 to $50,000 per medical record that's exposed in a breach, whether it's IT or paper. So it's this wide range. And what they do is they evaluate what they would call negligence. So were you doing what you're expected to be doing, and this happened anyway? And so that penalty swing can get pretty brutal for some groups, but really comes back to putting in those baseline requirements for meeting HIPAA requirements.
Sure. Well, let's talk about the electronic medical record for a second. And I know what you focus on is trying to make some of these regulations a little easier for organizations and practices to understand and deal with. But I guess an argument from docs and nurses is that as the medical record becomes more and more complex and there are more and more things that you need to do just to satisfy requirements, how is your everyday worker going to keep up with some of that? Is there a way to automate some of this?
Yes, that's a great question. And well, I see that burnout is definitely a major issue and very real. A lot of what the tools that we're working in today are driven initially by regulatory compliance. And this is my opinion, but I think a lot of what we struggled with in the usability of the health records was when our EMR, EHR was designed to meet government requirements first, or payer requirements first, and then be usable as a second. A second requirement, right? And so that was something just on the side as we designed Medcurity, we went, usability and design first, something that would be really intuitive, people could step right up into and start using within a couple minutes, and then took that and figured out how to meet all the requirements we needed to with that. But I think there are some great indicators that it is going to get better. I think what I would say is, yes, there's some automation, there's tools, that just the same concept as Medcurity, trying to pull some of this complicated, some of the things that are maybe tougher to get your arms around and help simplify that. But especially for the physicians, I like to encourage our groups to stay experimental and innovative on the IT side, because there's some technologies that maybe we saw about 5 years ago and it was a little rough and looked like it may not adapt to the environment. But now, I'll take a good example. Now at a recent conference, a vendor was showing their essentially an evolved dictation format, but where they had a smart room that could pick up. It was mic'd, and a patient and a physician sit down and they have their encounter, and kind of like having an electronic scribe, but all of the pertinent details were captured into the data elements that were needed. The chart was populated with the visit, everything that was captured in there, and the physician could look over and show and walk through some of those things. The provider was able to walk through those things with the patient, but not be entering the data as they go. It was just filling it in right into structured data, just based off of recognizing context in the discussion and pulling it all in. So it was really impressive, and some of the provider friends, as we were looking at this, were way more excited about that than we have in the past few years looking at voice recognition evolve. So I like to look at that as an example of, at some point, we're going to hit this point where technology actually becomes truly helpful and is making it maybe even better than it was before, instead of just being this creating all kinds of administrative and extra work on top of the workload for providers. So I think we're seeing some good signs that the technology is getting there to a point where we may be able to capture information in real time without turning a provider into a data entry person as much. So that's one example, I think, that we will see, and we are seeing some good improvements at this point. And so I think just hand in hand with that, if you have an IT person or an IT vendor, to continue to press them to bring some pilots to you, or bring examples of what people are working on, and to continue to experiment, even if telehealth is at all in the scope of what you may do in the future, to try to do a couple telehealth visits via different formats, because that's come a long ways too. And sure. And patients are beginning to see how that can be done well. And there's even starting to be a little bit of pull where some patient populations are expecting and requesting that. And so I think it was rough in the past, and I think we have some technology to make that more and more smooth for our teams. It's just different.
Yeah, I'm hopeful. I mean, I think the basis of the show is about communication, and I've had a few guests at this point mention that they feel that improving technology has detracted from interpersonal communication, whether that be between team members or between providers and patients. So we're hopeful that will get better, but I know this is currently a huge issue of frustration with all pretty much across the board.
Mm-hmm. Yeah, it was something to see the eyes light up around this, and I'll call it a smart room. I don't think that's what the vendor used, but around this technology where they just have it mic'd, but it's just a local storage, so you can explain in a sentence or two to the patient that it's not going anywhere else. But that to see the encounter just populate as a natural conversation occurs, no device, no screen in between the provider and the patient, that I think everybody was pretty excited to see that play out so well. So it looks kind of futuristic, but it's working now. So as we get that into daily life and into care rooms, that's something that could start to turn the corner in one piece of what you're describing. It's the ways that technology's gotten in between us instead of.
I mean, that's pretty cool.
Yeah, it's pretty cool.
It does like machine learning and artificial intelligence play into that, or how is? I don't know. Yeah, I'm sure you don't know the details, but.
Yeah, I pay attention to it. We are seeing more experiments. Some of our larger health systems are taking more aggressive. So I'm here in the Northwest. Seen health systems here take a more aggressive approach to getting pilots in place that are using AI and machine learning to augment what the physicians are doing. And it's going to be interesting. It's never smooth, but they're finding places to begin to. Like I saw it around chemotherapy pathways. They're finding places to begin to apply this where it, again, would augment a physician leading the way in a intervention or on taking care of a patient. But there's just got to be the right case studies of this and some experimenting around it. But it certainly looks like it's part of the future for us. And the right way, again, comes back to not breaking the ability for the patient to talk to the physician or to the provider, and where it's just augmenting, providing, decision support without dictating how that encounter goes, right? And I'm probably not the best person to speak to that, but I see the pilots that are going on. We follow those pretty closely, and I've worked with some of the project managers on those. And in oncology, I think we have some really interesting application for artificial intelligence backing up the provider's workflow.
Yeah, I mean, pretty cool stuff. Definitely looking towards a more futuristic, interesting next few years. I mean, technology just in the last 10 years has really exploded. So what the next 10 will bring, who knows?
Mm-hmm.
So I mean, the basis again of the show is team-based communication, and I know some of those increases in technology are interesting as far as provider-patient relationships. Do you see any changes in helping us communicate more effectively within the team in the technology sense?
Yes, I'll take that just a narrow view first. It's an important part of what we're doing at Medcurity. It's a conversation that we have fairly often. We see a process that I think there's many processes like this, but we took that risk analysis that I've mentioned. That's currently done by an individual or maybe a third party. It's handed off in a PDF, and it's kind of sits there often for the year, and then come back and do it again. And so again, at a micro level, the concept that we took there was let's not have this just result in a flat, basically dead on arrival document that's put on somebody's desk or put in a binder. We take what comes out of that, so focus areas and recommendations, and it's all available in a dashboard. And you can add, with a couple clicks, you can add multiple users. You don't have to go through a lot of steps. So what we've seen is a practice manager and their facilities person and their IT person will be able to each jump into a dashboard. They can see their areas of responsibility. They can see overall, as they work through this, they can see the risk to their organization be reduced, and you can report on that. So again, that's just a micro level, but I think technology used well will bring some visibility to it. Another place that is getting better is patient and population management, right? Some of those population health tools are now getting to where they're actually pretty useful, slick ways to be able to look out across your panel or population and hotspot where you need to focus or target specific segments of that population. And they're driven, the pop health side of it's driven a lot by payer contracts. So that's been really interesting to watch, because as the payers get better information, they can basically work with the payer to be incentivized to care for your patients in different ways, in new ways or added ways. And I think that's really interesting, because again, I'm maybe stepping a little bit away from the team, but I think being able to see at a high level dashboard views of what we're working on and having conversations around that. Basically, what I see that do is it unifies the team around a mission of what we're working on. Everybody has their own perspective and their own view of a project or an initiative or a purpose. If we can put them on the same page, and they can all see, possibly in real time, but they can all see a view of what we're making progress on. That helps a lot from my perspective, to have that shared mission, that shared understanding of what our results, the outcomes that we're looking for. And so that's something that, to kind of summarize that's the way, even internally as a company, we work. We have, of course, the mission that we're working on. We have some key objectives that will play into that. So, for example, we want all of our customers to be evangelists and to be fully excited about the product and the tools. We have results under that, but here's some specific things that will lead to that, and then we have ownership of those specific items. But all of that rolls up into a shared mission and a shared understanding of objectives. And so I've seen technology be able to start to take tasks that you're often running on just your panel or just these few patients or just this project, and to be able to get a shared view of the overall purpose of why you're doing this, that you can look at with other people. You understand your slice of it, but you're all working together. It really helps. It helps everybody have a shared language around what they're doing. It helps you understand your piece or your fit into the overall mission as a team, and it really builds. From my perspective, it really builds teamwork, and it helps make decisions faster and make more sense to everybody. So that's a rambling answer to how I've seen technology play into, I think, unifying teams into having some good perspective of bigger picture, how all these little pieces fit together when you use dashboards right, when you use the kind of management software like that correctly.
Yeah, no, I think you had a lot of very interesting points there. And I think what you're saying is generalizable to a lot of different industries. So not rambling at all. Those are some great points. So Joe, I'd like to just transition the show a little bit at this point to get to know you a little better to the listeners. So you talked about your company. What do you like to do for fun?
Well, I am in the Pacific Northwest, which I love. I think love the whole country, and I think what we have in this area in Eastern Washington State, we have a lot of lakes nearby, a lot of outdoors, and right now building a startup, a technology startup, is pretty consuming. So I just prize those opportunities to get my family, my wife and 4 kids, and we get out of town and get somewhere close to water or out on the water. Those are the best days. On the other hand, we have winter here, so at this, in the spring, we're kind of counting the days toward the spring and toward some warmer days, so we can get out there and be in the sunshine on the water. And it's definitely something that refreshes me. We have a lot of disc golf in the area too, which I don't know why I find disc golf slightly less frustrating than regular golf. So get out and throw some frisbees around. We have some great courses that go through the state parks and county parks around here. So those are things that get us outside. Yeah.
Yeah, I'm out in Buffalo, New York, so we're counting the days down to our 6 weeks of summer that we get. Do you have any book recommendations for the listeners or something you're reading?
Sure. Yes, I actually just reread I'll show my focus on the business side, but there's a book called A Sense of Urgency by John Cotter. And I think that book is really important. I've gone back to that several times, whereas I don't read a lot of books multiple times. But A Sense of Urgency is a book that talks through the critical element of speed that we have these days in most businesses to be moving forward quickly, but without creating panic or unhealthy stress around that. And so I find that book really helpful because it talks through how to get your team moving quickly. From a healthcare standpoint, we have some really important things to solve. And from just right here specifically at Medcurity, there are some threats that we want to stay ahead of for the sake of our clients. So the speed is really important. And it could easily devolve into just panic where we're stumbling over ourselves to just move forward fast. And so Cotter talked about, in that book, he talked about, how to share what's happening in the market or what's happening in the industry, what's happening with, say, competitors or with our clients or patients, and using that to set urgency. But then he also talked through some of my favorite parts of that. He talked through how to behave with urgency. So as a leader, setting that pace on a daily basis that is controlled, but you're present and you're purging tasks that don't matter as much. You're speaking with passion with your team and being really clear on the direction that we're headed in. And then approaching those crises that come up and looking for opportunities we can learn out of that. And using those to shake up any complacency that's settled into our teams, and not just looking at crises as damage control opportunities. So I think he just does a very nice job of talking through leadership in an organization and bringing speed in without the chaos that could accompany that. So I highly recommend that book, and I just wrapped up reading through that again.
Yeah, I have not read that one yet, so I will put it on the list. So, Joe, if you could just give just a single piece of advice to physicians and other clinicians in the aspect, and maybe from your perspective, from an IT perspective, what would that be?
So this will maybe summarize some things that we've talked about already today, but I would say to experiment. I think I mentioned that it's sometimes we look at technology and it isn't meeting our needs, but it is evolving very quickly. And I have found, just to give one example here, I've found that some practices that experimented with care transitions and sharing information with other groups in town or with the hospital system as their patients move through the system. And that was broken, or at least difficult, for a lot of years. But we have some really specific parameters in place now that are pretty well standardized. And you can actually have a very, in almost all EHRs today, a very smooth process of sending and receiving information along with a referral, a care transition, and not just getting a 50-page document in your EHR that you're never going to have the time to look through, but getting structured data that can be taken into your system when you're receiving the patient, and can have somebody on the team do that, get exactly the information that you want to consume or digest into the EHR system. So I would say to keep again, the IT folks focused on what's available now in the EHR, and let's test it with the community and work on sharing information. But all of that said, there's still, and there always will be, important times to pick up the phone. And I don't expect that technology is ever going to replace the value of a clinician-to-clinician conversation in some care transitions. And that goes way outside of that example as well. So I think to continue to push technology, but we're going to always have a place for those person-to-person communications, and not to have those absorbed into emails or automation, probably ever.
Yeah, well, I definitely agree with you there. Well, if people want to learn more about your company or get in contact with you, how can they find you?
Thanks. We are at medcurity.com, but we're also on the social media channels, of course. So Facebook. On Facebook, we do a Medcurity Live weekly quick live video where we talk through hot topics from primarily a privacy or security standpoint, but also other topics in healthcare. And so that's a great opportunity to just have a staff member or yourself stay current on what's going on in this world. And then, again, just our website, and welcome any emails or questions. So we're available to provide guidance or whatever's needed at any time.
Great. I'll put all that information in the show notes for the listeners. Joe, it's been very fun and enlightening. I learned a lot about things I didn't even know about. So I want to thank you again for coming on the show and being part of this.
Thank you so much, Andrew. I enjoyed the conversation and really appreciate your time and thoughtful questions. All
right, Joe. Well, take care. We'll talk soon.
Thank you. Take care.
What a thought-provoking episode that was with Joe Gellatly. Joe starts off by explaining some of the CMS compliance programs. He speaks about his company's goal to focus on privacy and security requirements, especially HIPAA. Within smaller practices, he works directly with physicians to try and give them peace of mind in regard to compliance and cybersecurity. Joe throws out an astounding figure that HIPAA penalties can range from $100 to $50,000 per record. He feels that the electronic medical record is getting better, although it was not initially designed for usability. He speaks to some of the advances in medical record technology, such as dictation rooms, which sound pretty cool. Joe is hopeful that AI and machine learning will improve the user experience. Well, that's all we have for today. Thank you again for listening. Please follow me on Facebook, Talk2MeDoc Podcast, which is the page, as well as our private Facebook group, Talk2MeDoc Community. I really would like some feedback on the show, so if you have any thoughts, positive or negative, please email me at andrew@talk2medocpod.com. That's Andrew at talk2medocpod.com. I'd love to hear from you. Thank you all again, and keep talking. All opinions expressed by the guest in this episode are solely the guest's opinions and do not reflect the opinions of Andrew Tisser DO, Talk2MeDoc LLC, or any affiliates thereof. The guest's opinions are based upon information he or she considers reliable, but Andrew Tisser DO, Talk2MeDoc LLC, nor any affiliates thereof warrant its completeness or accuracy. The guest, Andrew Tisser DO, Talk2MeDoc LLC, or any affiliates thereof are not under any obligation to update or correct any information provided in this episode. The guest statements and opinions are subject to change without notice.